Hello everyone. So this is just a small video on how will you define the tooth extraction. The definition of tooth extraction was stated by Jeffrey Howe. Now being a student, the first thing which comes to our mind after listening the term extraction, that is the removal of tooth. But we can't write this in examination or we can't tell it to the examiners during Viva. That is just a removal of tooth. But we can definitely build our definition around these words, that is removal of tooth. And if you concentrate, I assure you that you will never forget this definition ever in your life, or you might need just one read to memorize it again in future. So let's proceed. So basically it's a removal of tooth. Yes, you are right. The root pieces are the indications of extraction too. So to be more precise, we can say that it is the removal of whole tooth or tooth root, right? So it is a removal of whole tooth or tooth root. Now, if you are attending clinics, the oral surgery postings in your third years or in your final years, the first thing you notice that before extraction, we administer the local anesthesia so that we can block the nerves and patient does not experience any pain during the procedure. So the next term gets added in the definition is it is the painless removal of whole tooth or tooth root. See, we first started with removal of tooth, then we said that it is the removal of whole tooth or tooth root, right? Many a times we extract the root pieces also. Many a times it's a grossly carious tooth, so it is the removal of whole tooth or a tooth root. But we don't directly extract the tooth. We first administer the local anesthesia. So it is the painless removal of whole tooth or tooth root. Now we'll proceed further. Whenever we extract the tooth, whenever we remove the tooth, we should be as gentle as possible because we should not be traumatizing the surrounding teeth, the gingiva, the alveolar socket itself. It should not be like that we are exerting as much as the pressure. So next sentence which gets added is it is with minimum trauma to the investing tissues. Investing tissues means the surrounding teeth, the surrounding mucosal area, the gingiva, the alveolar bone itself. So what is our definition looks like now? It is the painless removal of whole tooth or tooth root with minimum trauma to the investing tissues. The next sentence which will be added to the definition will talk about the complications, the post-operative complications. Post-operative means after the tooth extraction, after the procedure, post-operative. So to know about the complications, you need to study about the post-operative complications of tooth extraction. That would be another session. So let's talk about one of the most common complications after the tooth extraction is the dry socket. It is the painful socket, it is the non-healing socket, or whenever after extraction the tooth socket takes more time to heal with pain. And one of the most common causes of the dry socket is traumatic extractions. That's why we have stated it here as the with minimum trauma to the investing tissues. So what is further now? So that the wound heals uneventfully. So what event we are expecting? The events are the post-operative complications. But if we are doing the minimum trauma, the wound will heal uneventfully. Now the last part of the definition talks about the department of prosthodontics. Now we will ask, this is the oral surgery question. How you are taking the name of the department of prosthodontics? So if you have started your postings in the prosthodontics department, if you have started making complete denture in the oral cavity, the first thing which we have to do is get our patients approved. And what does the staff check in the oral cavity that there are no sharp bony ridges, there are no bony spicules, there are no sharp bony irregularities in the mandibular ridge as well as the maxillary ridge. And if there are any irregularities, the patient does not get approved. Then it is referred to the Department of Oral Surgery for the pre-prosthetic workup, like alveoloplasty. Our last sentence of definition is no post-operative prosthetic problem is created. So we are now done with the definition. So our definition looks like it is the painless removal of whole tooth or tooth root with minimum trauma to the investing tissues so that the wound heals uneventfully and no post-operative prosthetic problem is created. We started with the removal of tooth. It is a removal of whole tooth or a tooth root. It is the painless removal of whole tooth or tooth root with minimum trauma to the investing tissues so that the wound heals uneventfully and no post-operative prosthetic problem is created. I hope you understood this definition, and the first thing which I want you all to do is just memorize this definition step by step in this manner, and then you will never ever forget this definition, or you will just need the one or two reads of this definition to memorize it again.